Greetings from the South African community. My name is Lindsay Shahim, and I'm first of all a registered nurse and have the privilege of being the director of NuAngle Medical. NuAngle Medical is the Southern African representative of coloplast interventional urology. Today, I have as my guest Dr. Bhavik Shah. Dr. Shah is a urologist who specializes in male health in Atlanta, Georgia, in the United States. Dr. Shah is joining us today as he'll be visiting us in September as we continue the journey of upskilling urologists in South Africa and raising awareness to patients suffering from erectile dysfunction and male stress incontinence. We are very excited to welcome you back to South Africa, Dr. Shah. You visited us in 2022 to start the journey with the South African urology community and upskilling and the awareness of erectile dysfunction and stress incontinence. Can you share with us some of your why for coming to South Africa and why this is so very close to your heart?
Thank you, Lindsay. And again, it's a pleasure to be here. I mean, an absolute pleasure to work with you guys and to try to go on this journey. This is something that I've been wanting to do for a while, and it's almost personal in that when I used to live in Botswana and South Africa, and when I was 6, our family got in a car accident, myself included, and I ended up needing hip surgery. I had a hip fracture, and so I remember being flown from from Gaborone, where we were, and getting flown, I believe, to Joburg. And there, a orthopedic surgeon flew in from Canada at the time. He would spend some time in South Africa, doing surgeries, and then the rest of the time in Canada. And he flew down from Canada, operated on me. Everything went great. I went through the recovery process, and then that was that. But that thought and that memory of someone flying down from another country just to help me, and I'm a nobody, but just to help me, just always reminisced with me. And I've always wanted to give back to the country that helped me when I was in need. And I don't do orthopedic surgery, right? I don't fix fractures unless it's a penis fracture. That's the only bone I fix. But so what I'm passionate about, and what I'm very good at is and helping patients that have undergone treatment for prostate cancer and now they're trying to recover, or even patients that don't have prostate cancer but have erectile dysfunction or urinary leaking or things such as that. And those are the things that I've become very good at treating, and I want to make sure those skills are available to South Africa. So not only is it a country that I've been wanting to help all my life, practically, but it's a disease process that's increasing as we treat more and more prostate cancer. It's a disease process that really needs more help, and there's just so much available that we can do that's currently not being done at the volumes that are needed. And so the goal is to try to introduce that, teach that, help grow that, and help patients over there get the care they need.
Dr. Shah, you've dedicated your life's work to male health, and you serve as the Director of Men's Health at the Advanced Urology Practice in Atlanta. Can you tell us why this particular area of medicine has inspired you so greatly?
Yeah, I mean, that's another good question. Of all the things that I could do, why am I focusing on genital health, or right, and men's health in general? And I think that's the ultimate question. And what's drawn me to men's health is the fact that most people are actually afraid to manage men's health. And on the flip side, most men are afraid to seek out help. And so it's this small niche in urology in general, where you have people who are afraid to treat this because it's a very sensitive area. And you have patients who are afraid to get care because It's a sensitive area. And so for those two reasons, there are just not many people that treat this as effectively as they otherwise can. And so I love challenges. And to me, that's the ultimate challenge, right? Trying to help fix or grow or expand a field that people are afraid of from both the patient's perspective and a surgeon's perspective. And so I think there's a lot of room for improvement. Even just raising awareness like we are today, that alone is going to, is going to help in just, unmeasurable ways. And so I think it starts with raising awareness, and then the next is providing and making sure that the tools are available so that when a patient is ready, the surgeon is also ready. And so if we can align everything, then everybody gets the care that they need. But to answer your question, the reason I'm so passionate about this field is because I love taking on things that other people are too afraid to do and make them better. And so that's just, I guess, something about me that sort of stands out.
That's incredible that you do that in an area that there's so much need. I think what my next question is about the misinformation that's around in the male health environment. There are many unregulated treatment centers. This leads to many men ending up with irreparable damage to their private areas. How does a man know that he has erectile dysfunction or stress incontinence? And how does he know that it can be treatable? And where should these patients go for their first encounters or their first treatments?
Yeah, that's a great question. That's a problem everywhere. It's universal, not just in South Africa, right? Even here, we have patients that hear on the radio, advertisements on the radio, or see something on TV, or read something in the paper about, erectile dysfunction, and they say, well, if prior to that, they'd never heard of treatment options. So that's their first exposure. And so the ones that are bold enough to go will go to a treatment center, and they'll get what we can call unregulated treatments, the most common being injection therapies that can cause harm. There's nothing wrong with regulated, well monitored injection therapies, getting the right injections, the right treatment, the right dosing. But a lot of these centers, in a sense, are making, they're financially profiting from you, whether you do well or not. And those are the centers that I worry about. If you go to a well-reputed center, a urologist who practices in men's health to some degree, they can offer you injection therapies as well, but at least it's treatments that'll work. Because what can happen is, let's say you get an injection therapy, and then you get an erection that lasts too long, and then it's not taken care of. Well, if you have an erection that lasts too long, what that means is the tissue of the penis is constantly pulling blood flow out of the penis, but there's blood just sitting there. And now that blood that's sitting there has no oxygen. So it's constantly pulling oxygen out of there. When you don't have enough oxygen, the penis can start scarring down. And when that happens, you'll never get an erection again. I'll tell you, when I went down there last year, the vast majority of the penile implants that I ended up having to do were certain patients that had had an injection therapy, ended up having an erection for way too long, had severe scarring, since then hadn't had an erection in 5-10 years. And then we went in and tried to put in a penile implant to try to save them. They lost a lot of penile length, and some of that's never going to come back. But I went in there and we were able to put in penile implants to help regain some of that erection. But the length loss, the scarring that's formed, a lot of that won't go away. So if you can avoid that and get the correct treatment from the beginning, you can end up having better outcomes.
Sure, that's very interesting. Dr. Shah, one of the procedures that you will be doing again in September when you visit South Africa again is penile implant surgery. Can you tell us why this procedure is one that you recommend so highly and devote your time in training other doctors to perform it?
Yeah, Absolutely. So what I'll tell you is there are a number of good treatment options. There's medications, but I know it's not as readily available in South Africa. There are injections, but if they're not well regulated, you could end up getting scar tissue like we talked about, right? There's a vacuum erection device or penile pump. Satisfaction rates on that are very low because most of the time when you take the pump off, you lose your erection. So then you start running out of options. The satisfaction rates on most of the other options are 50% or less, right? The vast majority of patients are just not going to get what they're trying to gain. On the flip side, a penile implant is a surgery with satisfaction rates as high as 98%. Very, very high. And it's very uncommon in medicine to have satisfaction rates that high with almost any treatment. So it is amazing we're able to find a treatment with such high satisfaction rates. The other benefits of this is once you have an implant in, you can have an erection when you want, you can keep it up when you want, you can bring it down when you want. If you keep an erection too long, it's not harmful. So it gives you back that control and maybe even better than you had before, right? And so that's amazing that you can do that. There is a risk with surgery, like there is with everything. It's a pretty low risk with this one. I mean, the reported rates of infection, which is like the big dreaded complication with any prosthetic surgery, like if you get a hip replacement, knee replacement, any surgery at all, the concern you worry about is infections, and even that the infection rates are around 1%, so they're very, very low, right? So it's a great surgery that has very high satisfaction rates, low complication rates, and it's a surgery that that can allow you to be maybe even better than you were before all of this even started. So I mean, there are very few things out there that can do that.
That's very interesting, Dr. Shah. Can you tell us a little bit about incontinence in men and the options that you would recommend as you will be training the urologists in South Africa on implants as well as incontinence surgery? If you could give us some information about that.
Yeah, so incontinence is depending on what kind of incontinence we're talking about. If we're talking about stress incontinence, which is likely what you're alluding to, stress incontinence is something that almost exclusively is seen in men that have had some sort of prostate treatment, whether it's radiation or surgery or shaving or something along those lines, most commonly being surgery. So those are the patients that are most likely to have what we call stress incontinence. Stress incontinence is if you cough, sneeze, stand up, walk, that's when you leak, that's stress incontinence. The classic treatments for that are typically surgical. And one of the treatment options that we'll be doing down there is called a sling. And it's a treatment that'll tighten up the sphincter and the urethra. So what it'll do is think of your urethra, which is the channel you pee out of, like a hose. When you turn the hose on, it pours. If you kink the hose a little bit, it'll pour slower. If you turn the hose off, or just turn the hose on slow, it'll still pour. And if you kink it, then it'll stop pouring altogether. The problem is for most patients that even when they're not actively trying to pee, just any pressure on their bladder, like if you cough or sneeze, your body's putting this internal pressure on the bladder itself. Any pressure on the bladder is like turning the hose on low. And if there's no resistance or very low resistance, you're still going to leak. So what the sling does is it tries to bend that hose just a little bit so that you need a faster pressure in order to pee. And normally when you're actively trying to pee, your bladder is able to mount that pressure. So it's just increasing the resistance in the hose to make it so that you don't leak or reduce the leaking significantly.
That's fantastic. Thank you, Dr. Shah. We're very, very excited to welcome you back in September. We really are. The surgeons are very excited to see you, and I'm sure the patients will be very excited to see you. So I wonder if you have a message for the surgeons and the patients that you'll be seeing in September when you're here, if you'd like to say some words for that audience.
Sure. I mean, I'm just excited to come there. I love going down there. It's South Africa is just another home for me in a sense, right? I grew up in the area. I I appreciate everyone giving me the time and allowing me to spend time with them. I'm sure I'll learn as much as I teach, and I'm really looking forward to helping everyone down there. And that's about it. I'll see everyone in September. Just be ready.
We're looking forward to it very, very much. Thank you very much for your time. Much appreciated.